Hello, everybody. This week we are talking about policy and access. Again, in that sort of process of thinking about where do we see structural barriers? Where are the things that are built into the system that prevent people from having their highest achievable sort of type of health? Well, as we've been talking in terms of all of this class, structural sort of things exist. And if we want to be able to hit things at a structural level, not just a personal sort of level, well, we also have to do work on the structural level. So before I get started talking a little bit more, just a reminder that your Fire in the Ashes analysis paper outline is due this week. So make sure that you get that done. Choose a character from the book, talk about some of the health issues that they experienced, and then look for some literature around how these things could be mitigated from a policy access, from an access sort of thing. What are the structural barriers that are in place that they need to overcome in order to achieve their highest level of health? So when we think about access to health services from Healthy People 2020, which if you don't know what Healthy People 2020 is, Healthy People is the national plan for health in the United States. We've had several versions of it. Every 10 years, they update it with new standards and other sort of things. They'll be coming out with a new one since we're in 2020 now. So it should be Healthy People 2030. So what are our goals for the next 10 years? But in one of the big overall goals for Healthy People 2020, access to health services is one of those goals. We want to improve people's access to health services. According to Healthy People 2020, that means the timely use of personal health services to achieve the best health outcomes, and it requires 3 distinct steps. First, gaining entry into the healthcare system, right? Generally speaking, if you can't access the healthcare system, then your health is not going to be good, right? And so a lot of this happens through health insurance coverage, whether that be private insurance or public insurance. And so one of the things that happened under the Affordable Care Act was trying to get more people connected to services, because if you don't have access to services, well, then you're not going to have care at all, right? Next, you need to be able to be geographically located near your services. We shouldn't have to travel hundreds and hundreds of miles or across state lines to be able to get the care that we deserve. And so geographic availability, this becomes an issue in places like Butte County because we are considered a rural area. In Chico, it's sometimes hard to find a provider for things that you need. And so you have to go outside of Chico. The goal of Healthy People 2020 is to say, hey, we should bring more services to areas that are hard to reach, right? If you live in a big city, say San Francisco, not hard to get any possible sort of health service you need, but living in Butte County, it is sometimes hard to get the sort of services that you need. And then finally, for access to health services, you should be able to find a healthcare provider where you have built trust and can communicate with, right? A lot of this has to do with personal relationships and how do we achieve those sort of things? Well, as we've been talking about, cultural competency, having people who look like you or at least understand you is a really important sort of thing, right? And so when we think about these sort of things, gaining entrance to the healthcare system is an access issue. Having something that is located near you is an availability issue. And then having those personal relationships with people that you trust really comes back to that social capital that we've been talking about. So in terms of barriers to health access, what do we have? Well, we have the high cost of care, right? Especially if you don't have insurance. We know that for a lot of people, it is unavailable to be able to be reached because of the high cost of care. For a lot of people, inadequate or no insurance coverage. Some people might have basic insurance, but their co-pays or their deductibles are so high that it makes their health care sort of worthless. Lack of availability of services. And then finally, the one that we care the most about in this sort of class is talking about the lack of culturally competent care. Do people feel like they are understood, embraced, celebrated when they go to their providers, or are they felt like they aren't listened to, or that they're weird, or that they're somehow different and therefore undeserving of different sort of things, right? When we talk about the core areas of public health, we have social and behavioral health, which is what most of us in our department do. Epidemiology, in terms of the study of disease outbreak and the statistics around how people get healthy or sick. Biostats is another section of the core areas of public health that really look at the deep down sort of statistics that are related to people's biopsychosocial behaviors. Environmental health, where we live and work and play. And then finally, health services administration administration and health policy is the last core area of public health, how do we then use big picture sort of systems to affect the health of the people around us? When we think about these sort of things, public health has something called the 10 essential services and the 3 core functions of public health. All of them include policy development, which is a big part of why we have this as an entire sort of thing this week. One of the moves that both the CDC and public health in general has been pushing over this last couple of years, decade, is health in all policies, right? So just like we learned last week with education and with residential sort of living stuff, all of those things affect our health. And so the idea of health in all policies says, hey, all these things that may not necessarily be health do affect our health, right? And so we should be thinking about health in every policy that we make. And so health in all policies just says, hey, when we're making policies about transportation or about environment or about education or about all these other sort of things, we should also think about the impact that it has on people's health. And so that is the sort of general thrust of what health in all policies is to say, if we can build in systemic racism, why can't we also build in systemic healthcare? And so when we think about those sort of things, one of the bigger challenges of that is when we think about who are the policymakers. I have some demographic charts in the slides. These are based on spring because the fall results are not quite settled yet. But it looks at different sort of demographic characteristics. How diverse is Congress by race, ethnicity? How many women versus how many men? How many people who have different sort of religious beliefs? All of those things matter. And if people are not being aware of things that are not like them, oftentimes that's where we see these systemic sort of things built in. And so it's really important for us to think about, do our representatives actually represent all of America, or is there some differential sort of process in there? Of course, we know that we don't have perfect representation. And so we just have to think about those sort of things. How do we get our representatives who don't look like us or who don't have any sort of common background with us to think about us in the work that they do at the policy axis? How do we get them to care about health in the overall sort of picture of all the things that we have to do in this country? Do we think that we have enough representation? Are we talking about these sort of issues? And why is this information important to know? All of those sort of big picture questions are things that I want you to think about this week. For this week, I want you to think about who are you and what does your world look like? Think about things that happened when you were younger and things that are happening now in terms of what people look like in your world. There's a worksheet activity that I want you to do, and then there's some reflective questions about it in your journal. So you'll have to fill out the worksheet, which has a couple questions on it, and then I want you to reflect on it and think about how has my life been shaped by these different sort of access issues. All right, that's all for this week, and I'll talk to you in 2 weeks. Bye.